Welcome to Total Healthcare, where each patient is provided affordable, accessible, and comprehensive care under one roof. We provide continuum of care and emphasize on healing, health, and hope.
My name is Faye Royale Larkins. I'm the Chief Executive Officer of Total Healthcare. It's my great pleasure today to share with you the power of healing, health, and hope. As a resident of Baltimore City, a native of Baltimore City, I am so pleased with the commitment that Total Healthcare and Turk House have made to the community to bring that healing, health, and hope. Next, you will hear from Cyril Scovins, someone's story that I am proud to know.
Welcome to the Turk House. My name is Cyril Scovins. I'm a community outreach coordinator here. But the story goes back a little bit further than that. 34 years ago, I was born an addict. I was born addicted to alcohol. But the story changed because for 21 years now, I've had no alcohol in my system whatsoever. I got to that place through places like Turk House and Total Healthcare. There's a way out of the pain and the misery. There's a way out of the trauma. That's all a part, because it was all a part of my story. Trauma, mental health issues. That's the part that goes with addiction that pretty much goes untold. That I understood that now I will be able to see somebody get what's called holistic health, where they can be treated for everything, their mental health, along with their spiritual needs, along with the needs that they have for trauma that's been untreated. It's a brain disease. It's a disease of the brain that affects all of our actions, emotions, and how we react and emote to everything that ever happens once you become addicted. When I found recovery, my whole family found recovery with me, because my recovery became their recovery. The beauty of what Total Healthcare is bringing is that we're going to also be able to treat for the mental health. There's going to be a clinic on the first floor, a Total Healthcare clinic. And actually in this area right now, there's no clinic of that nature for anyone here. I'm excited that they're going to be here. I'm excited that the kids are going to be able to get their health care done. A merger of this type between a medical facility like Total Healthcare and a nonprofit treatment facility like Turk House to become something that's never been done. And because I believe in it and I understand that it's not just going to benefit me, my family, but this community, the state of Maryland, and eventually, we do the model right, the world.
We have 10 sites across West Baltimore, one site in East Baltimore on Kirk Avenue, and then one in Anne Arundel County. It's what's called PCMH, it's Patient-Centered Medical Home. So we wrap medical services, the whole array of medical services around a patient so that that patient gets to receive total health care. So we provide primary care, which includes adult medicine, pediatrics, OBGYN, have optical services for eye care, we have dental care, and then in IBH we have infectious disease, which includes HIV and Hep C, and then we have the mental health service. CASH stands for the Center for Emotional and Social Health. There's a stigma about health care, period, but there's particularly a stigma about mental health care. Someone would rather be in substance treatment than be in mental health care. The problem is this: substance abuse tends to be a symptom of a pre-existing mental health problem.
It's been a long road, you know. I've gotten sick back in a few years ago, and I lost a job and had to change cities, and many different things happened in such a short period of time. You know, and I always felt like I was like Superman, you know, I can't get down, nothing can break me, you know. There came a point where I had to start focusing on myself. You know, after a while your body started breaking down, and, you know, found out that I had diabetes, which I wasn't really taking too seriously when I first heard about it. Then I got septic arthritis. I had to have surgery for that. I came to Total Healthcare for my son to help with his ADHD, to help him understand it. and to help me to help him understand it. And during the process, I was told that, you need to speak to somebody. And I said, no, I'm good, just deal with my son. I don't need anything. Because I still couldn't believe that somebody like myself can suffer from depression, along with being diabetic and having all these different ailments and dealing with the day-to-day activities. You don't think of yourself as someone who can go through that. At first I felt bad because I'm taking the focus away from the kids. I need to be stronger, not just physically, but mentally,
Then one day, I just couldn't breathe. It felt like someone had knocked the wind out of me. So I went to the doctors to see my PCP. And she told me I had asthma, then explained it to me. Her name was Dr. Carrington, and she was just so nice. I broke down in tears as I told her about my life. I told her that I was just so misunderstood, and she comforted me in a way only a mother would. A month or two passed, and my asthma had gotten worse. I got the news that gave my entire body a chill. I had lung cancer, and it was a big deal. When I found out I was pregnant, she was so excited for me, and she encouraged me to get my life back together for my new family. I went back to school, graduated, and looked for a job, kept every doctor's appointment. I was off to a great start. So now I'll be teaching our children poetry, something that is so very important to me. It has shown me miracles can happen and dreams do come true. You just have to play the hand that was dealt to you. And remember, when life gets crazy and wild, create your own Diary of a Misunderstood Child.
In and out of detoxes, in and out of treatment centers, in and out of prostitution, all the stuff that comes with, getting high. It was real hard. It was cold, desperate. I always felt myself real desperate. The desperateness just came from, wanting a bag of crack, wanting some weed, wanting some alcohol, wanting anything that'll take me out of the state of mind that I was already in. Other treatment centers didn't have that type of program. Matter of fact, I don't know one that does have treatment programs where the advocacies come in and actually you meet them before you even enter the program. When I found the MAP program in the Turk House, I remember being in there. And I was introduced to the MAP program, and the MAP program worked for me inside the treatment center. I started taking my medical assistance treatment inside the program, and the MAP people would come weekly and visit us just to see and check on us and see how we were doing. And that made a difference, and they got to see our progress. They asked us all, how were we feeling? Were we okay? What's going on with you in the Turk House? And the Turk House was lovely. I had no problems. The only problem I had was with myself, with the disease of addiction, and was I going to be able to do this?
It's my vision that Total Health Care and Turk House will continue to change lives. Not only change lives, but change families and change our community as well. Through providing a continuum of care to our patients, we are giving them healing, health, and hope. And in so doing, we're doing the same for our community. I hope you will join us as we make a difference in the lives of the citizens of Baltimore.